Hi team, and welcome back to Doctor's Notes. In this video, we will focus on some key concepts to help us differentiate between different histology slides on the epithelium tissue as well as the connective tissue. As you are aware, there are four main tissue types in the body: epithelium, connective, nerve, and muscle. We'll focus on just two of the body's main tissue types, and that's epithelium and connective. We'll first focus on epithelium tissue. Epithelial tissue is going to be the type of tissue that lines or secretes something, mostly because it is involved with some sort of protection to an organ or to another anatomical structure. Because they need to line and secrete, they are comprised of tightly packed cells so that it is not easy for other substances, foreign matter, to travel through this epithelial tissue layer. When we describe epithelial tissue, we do so by asking some questions. Three main questions is what I refer to. Now, epithelial tissue will always have an apical surface and a basal surface. The apical surface can have structures like microvilli and cilia, but it will always be open to seemingly empty space in the body. And so on a tissue slide or a histology slide, it will look like it is opened up to or next to white space, typically the lumen of some sort of vessel or space. On the other hand, the basal surface is not next to seemingly empty space. The basal surface typically is the area of the epithelial tissue that lines the next type of tissue beneath the basal surface. And this is typically some sort of connective tissue or muscle tissue. If you see an apical surface and a basal surface, you're most likely looking at epithelial tissue. And so it was one of the key questions that I ask myself when I'm looking or presented with a histology slide. That's going to be really helpful for helping you identify epithelial tissue versus connective tissue, because connective tissue will not have a clear apical surface or a clear basal surface. The next two questions we ask ourselves when it comes to describing or identifying epithelial tissue is how many layers you see. And what I strongly advise my students to do is to look for the nuclei, layers of nuclei, to help you answer this question. Just because epithelial cells can vary in shape and size, that it may be difficult to identify how many layers if we are looking at just shape and size of the cells. If you track the nuclei, it'll be a lot easier to determine whether you're looking at just one layer or if there are more than one layer in the epithelial tissue. Next question we ask ourselves is, what type of cells or what shape the cells have? In anatomical terms, this is referred to as cell morphology, and you only really have three types to choose from. They're listed on the slide in each of these columns. So the first is squamous, and how I typically remember squamous is that these cells look squished, looks like they've been packed down nicely, so they have more of a squished appearance. This is squamous cells. If the cells have a square-like appearance, like this right here, and this right here. We refer to this as cuboidal, and the best way I remember this is to remember that cuboidal, one side of anything cuboidal will have 4 seemingly equal sides. The other option, third and final option you have, is columnar. And with these columnar cells, they look elongated in a longitudinal format. Most resembles a pillar. So there you have it, squamous, cuboidal, and columnar. I failed to mention earlier why the number of layers in the cell is important. Well, that helps us describe epithelial tissue. And so if there's only one layer of cells in the epithelium, we refer to that as simple. If there is more than one, there are more than one layer of cells, it's referred to as stratified. And so then you can combine those two names together to come up with a descriptive way to identify the histological slide you're presented with. Simple squamous epithelium, simple cuboidal epithelium, simple columnar epithelium, stratified squamous epithelium, stratified cuboidal epithelium, and stratified columnar epithelium. I know these are all epithelial tissue because there's an apical surface and a basal surface in each of these schematic examples. So ask yourself those 3 questions to make sure you're looking at epithelium and to make sure you are describing epithelial tissue accurately and correctly. There is a scenario that doesn't quite fit this mold, and this is what we refer to as transitional epithelium. This is often confused with pseudostratified columnar epithelium, and I don't have a pseudostratified columnar epithelium slide, so I encourage you to reference your textbooks or another reliable resource to compare and contrast. What I recommend my students do is, again, look at the nuclei of the cells. In pseudostratified columnar epithelium, not only do you see clear columnar shaped cells, which is different from what you see here. Got a bit of a mix of everything. A little bit of columnar right here and right here, but also somewhat cuboid over here, here, and here. You can look at those features. You can also look at the nuclei, which tends to be a lot more reliable of a factor. In pseudostratified columnar epithelial tissue, the nuclei of the cells tend to be more jam-packed towards the basal surface of the epithelial tissue. Contrast that with transitional epithelium, where the nuclei of the cells are scattered throughout the many layers of cells that you may see in this epithelium. And so when I think about transitional epithelium, it really is a mishmash, for lack of a better phrase, of different types of epithelium. And because it really can't fit into any of these boxes, we consider it transitional epithelium. A key organ in the body that has transitional epithelium is the urinary bladder. Let's shift gears a little bit and talk about connective tissue. So connective tissue is a bit of this catch-all category for tissue types in the body. Epithelium tissue will line and secrete, and so will have a distinct appearance, like we just discussed. Nerve tissue has a distinct appearance as well, which will be covered in a different video. And muscle tissue, there are 3 types, also have a distinct appearance, which will be covered in another video. And so what I typically recommend my students do is to identify whether it's epithelium, connective, or nerve tissue first, If it's not any of those things, then it is most likely a form of connective tissue. There are several types. There are fluid connective tissue, of which blood falls into that category. Bone and cartilage are also a type of connective tissue. And then there's other examples referred to as dense or loose, and there are these subcategories that we can classify them in based on the appearance of the structures on a histological slide. We'll spend the next several slides honing in on what these are so we can become more familiar with how to describe these if you're asked on a quiz or exam. Let's start with dense connective tissue. Dense connective tissue are what we see here. This is an example, and this is an example. With dense connective tissue, the elements of the tissue appear very close together, quite tightly packed. And I know tightly packed was a term that we use for epithelial tissue, but notice here and here, there is no clear area where there's an apical surface or a basal surface. And so that is how we know we're not looking at epithelial tissue. Contrast that with loose connective tissue, of which this is a good example. Here's a schematic diagram. Here you can clearly see the matrix, appears like a web, and all the structures in this loose connective tissue are not densely packed with one another. Focusing in on dense connective tissue, there are two types, regular and irregular. What I recommend my students do for this is to look at the overall histology slide and to see if you can draw an arrow that best represents most, if not all, of the elements in the histology slide, specifically the direction in which they're going. So what I mean by this is, in this scenario, I can draw an arrow up or down to represent the direction in which most of these structures are traveling. Contrast that with this scenario where I will need more than one arrow to represent the different directions that these structures appear to be traveling. So this is dense regular and this is dense irregular. Another type of connective tissue is considered elastic tissue, and that is what we see here. Now, this is a very zoomed up version of elastic tissue. On many slides, it looks more like dark, short, seemingly short strands packed tightly with one another. So I highly encourage you to reference your textbooks or another reliable source to look for other examples so that you're not surprised on a quiz or exam with how that may appear. Elastic tissue is more tightly packed, not tightly packed as this is dense regular or dense irregular, but for the most part tightly packed, and these fibers look like they can be stretched, and that's because they can, hence the name elastic. Moving forward here to several examples of loose connective tissue. Here's a loose areolar where you see the matrix in the background. This is adipose tissue. Adipose tissue I best compare it to a honeycomb appearance. And this is reticular tissue. Now, the reticular tissue also has these black short fibers, which can be confused with elastic fibers. The big difference here is that these black fibers are not densely packed as what we would expect in elastic tissue. They're more loosely packed, And we can see other elements in the background on this histology slide of reticular tissue. This is an example of blood where you clearly see red blood cells. These smallest structures here are platelets, and these larger cells are types of white blood cells. Pretty distinct appearance. This is how bone appears on a histology slide. So in order to identify bone, you want to look for the presence of an osteon. Osteon is a basic unit of bone. Here's a really good schematic. In the central area of each osteon is the central canal where blood vessels travel to keep bone alive. The rings around the central canal, like rings of a trunk, is where the matrix can be visualized, right here. And then these darker stained areas are the osteocytes, so cells that make bone. Really important for maintaining bone structure. Another term that comes up is the lacunae. The lacunae are these spaces that are bordered by this matrix, and it's typically where osteocytes tend to reside. If you see an osteon, you're likely looking at bone, specifically hard, compact bone. There's another type of bone that we typically refer to as the bone marrow that has the presence of adipose tissue. That's known as spongy bone or trabecular bone. All of those terms can be interchangeable. So if you see bone-like structure with adipose tissue in between, you're most likely looking at some sort of spongy bone. That brings us to the three types of cartilage. The most common type is hyaline cartilage. Less common, but present in the body, are elastic cartilage and fibrocartilage. Cartilage generally has the presence of these chondrocytes. They look like eyes, many eyes, insect eyes is what I call them, dispersed throughout the histology slide. If there is a glossiness around these chondrocytes or eyes, it's typically a form of hyaline cartilage. You lose this glossiness when you see elastic fibers right here around these chondrocytes. This is elastic cartilage. If instead of elastic fibers, you see these densely packed fibers traveling in typically only one direction, this is known as fibrocartilage because of the fibrous matrix that surrounds these chondrocytes. So a common question students ask is, well, how do I know if it's just fibrocartilage, or this is fibrocartilage, or if I'm looking at dense, regular connective tissue? Well, in order for it to be cartilage, it needs to have the presence of these chondrocytes, so these eye-looking structures. If you're not seeing these eye-like looking structures, you're likely not looking at cartilage, and so your best bet is to find another answer that best describes the structures on the histology slide. That brings us to the end of this short series on epithelium and connective tissue. I know that histology is not exactly the funnest subject in anatomy, but one that's really helpful to know. So I hope I accomplished my goal of helping you differentiate between different types of histology slides, helped you come to a realization that it doesn't have to be difficult if you know what to look for and how to properly describe these structures. Thank you for spending the last several minutes with me. I look forward to seeing you in other videos.